welcome you to another interesting session of Mendel's bicentenary celebrations. I am Mercy Rofina, a PhD student in Dr. Vinod Skaria's lab at CSIR IGIB. So today we have with us here for the session Dr. Geeta Govindaraj, Professor, School of Family Health Studies of Kerala University of Health Sciences and a Professor of Pediatrics. She has got immense experience interacting with patients and patient families with various genetic disorders. And here she has joined us today to share her opinions and views about the clinical significance of Mendelian discoveries and overall field of human genetics. How has it progressed and how is it contributing to public health care? So we are glad to have you here in this session, ma'am. Thank you for accepting the invite and joining us today.
Thank you so much for the invitation. Thank you, and thanks to your institute, IGIB, as well.
Yeah, ma'am. So like I had mentioned, you get to see a lot of patients and also interact with their families and get to know what they're exactly going through on like a daily basis. So you would have seen a lot of patients. So it would be great if you could tell us what exactly or your research interests are, or are you focusing on one particular disease? If so, which disease are you focusing on more?
Okay. So we started our work on children with HIV infection in the year 2006.
Okay.
And since then, because of the availability of antiretroviral therapy and the prevention of parent to child transmission, we started seeing less and less of these children. Most of the mothers who were HIV positive had HIV negative children. But at the same time, we were drawn to the fact that there was another subgroup of children with inherited susceptibility to infectious disease, apart from other immunological problems like allergy, autoimmunity, and autoinflammation. So this group of disorders used to be called primary immune deficiency disorders, but now the new terminology is inborn errors of immunity. So when we were students, we were taught that you basically have two types of disorders, congenital and acquired. But now we are getting to learn that several acquired disorders, including malignancy, autoinflammatory, autoimmune, and allergic disorders, have a genetic basis. And it has been very, very interesting to know that how the germ theory is slowly giving way to the gene theory. So if you have a child with a severe infection, what we used to think was that it is due to the higher virulence of the pathogen. And we never focused on the host, so to speak. But now all this has changed. And we have been fortunate that we had a multidisciplinary research unit from the year 2015. And this was instrumental for us to get our work started, as well as our program that we now have on inborn errors of immunity is in collaboration with CSIR IGIB. We had a grant from the Science and Engineering Research Board, and we also had support from CSIR and the Foundation for Primary Immune Deficiency Disorders, USA. So it's been a very exciting journey.
Yeah, ma'am, that was like you took us through your whole journey from where you started and how you moved forward and how your interest developed in a due course of time. So
it just happened.
Yeah. So I have already mentioned that you get to see a lot of patients like experience what the family is going through because if they have a genetic disorder. So if you could share with us a few stories of families who had children suffering from this inborn errors of immunity or any other disease which you had come across in your career, it would be great. Like we are eager to hear from you.
Yeah. So there are so many stories that we have over the last 7 years, and they have actually enriched us as clinicians and as human beings as well. So there are lots of happy stories with good endings, and there are some sad stories. But for today, I'll tell you two stories which ended well. Okay. So the first one was about a 16-year-old boy who was symptomatic from early infancy. He had recurrent and severe infections. He used to spend about 3 weeks every month in hospital. He had been hospitalized several times. His mother could not really recount how many times, but around 25 times, she said. And he had a plethora of infectious diseases, including pneumonia, pyogenic meningitis, and he also had septic shock. So, all this was due to severe infections, and he also needed surgical procedures for removal of collections of pus around the lungs. We call it empyema. So, in short, he had a very unhappy childhood.
Mm.
So, when we started our work, we found one of his second cousins was diagnosed to have X-linked A gamma globulinemia.
Okay.
So we were drawing the pedigree chart and finding out who else in the extended family had similar problems. And they said there's another boy, but
Mm.
that's different. So we said, we went a little further and said, okay, who's looking after this boy? And we contacted the pulmonologist who was looking after him and told him that, see, your patient has a second cousin with X-linked A gamma globulinemia. So your patient could possibly be having the same disease.
Okay.
Could you please send him over to us? And
Mm.
he very kindly sent the patient over to us. He was at the time being treated for another disorder called cystic fibrosis, which
Mhm.
is again one of the phagocytic disorders where the mucus is extremely viscid and they're susceptible to very severe infections. So we found that this child was actually having X-linked A gamma globulinemia with absent B cells, and all his immunoglobulins were extremely low.
Okay.
So, what we did was we started him on monthly infusions of immunoglobulin, and he started getting better. But by the time he had already developed bronchiectasis, which is a chronic disease affecting the lungs, and therefore he had a permanent disability, and he was also having recurrent bouts of coughing out blood.
Okay.
But still, his quality of life dramatically improved. He did not require any further hospitalizations. But the sad part was, as I said, he really had lost his childhood, and the family were deep in debt. They had spent lakhs of rupees in private hospitals in
Mm.
Karnataka, mainly in Karnataka, because he belongs to the one of the northernmost districts of Kerala, the northernmost district called Kasargod district.
Okay.
So right now, he is working as a mechanic and he would like to become an engineer in the future. So this is one of the stories I'd really like you to hear.
Okay. That was
The
really,
second one,
uh-huh. That was really interesting, ma'am. Like when you told how he is doing now, although he had lost his childhood, which is not compensatable, like, but he has got a good quality of life now, and he has got some dreams for himself.
right. Okay, Mercy, I'd like to tell you a second story. This again was about an adolescent boy. He came to us when he was 15 years of age.
Mm-hmm.
And like the first child, he also had had recurrent hospitalizations, including ICU admissions and mechanical ventilation for respiratory failure. And he had been advised by a medical professional his mother had been advised to keep him in strict home isolation. He was actually kept in room isolation,
Okay.
and she would give him a bath herself every day. She would change the bed sheets every single day,
Mm.
change his clothes twice a day, and she stopped attending social gatherings. And the child also was practically confined to a room until he was about 15 years old. And he never went to school. He had been homeschooled. So
Okay.
there was she had been told that he had an inborn error of immunity. And one way to deal with it was to prevent contact with others who
Mm.
would possibly have an infectious disease. So she took this whole advice extremely seriously. Her husband was in the Gulf.
Okay.
So she tells me by the age of 15, he had never ever gone out of the house except to visit his grandparents. So the only two houses he had visited was those of his maternal and paternal grandparents. He never played with other children. Okay. And then when he came to us, we were able to find out that he was suffering from X-linked hyper IgM syndrome. Okay. So he was started on antimicrobial prophylaxis, including antifungals, and also on monthly intravenous immunoglobulin. So she got the confidence to send him out. So he started visiting other houses, started interacting with his peers. And there is this story which she told us that when he was 15, there was this teacher who was homeschooling him. And as she was teaching him, the child said that I would like to have an aquarium. And then she said, but then why would you want an aquarium? He said, I would like to have some fish at home. But she said, so it is not very good to confine fish to a small receptacle. Fish should be free to swim wherever they want to. But then he said, so what about me? Aren't I also an individual? How was I confined to a room all my life? So the teacher told the mother that this definitely has to change. And that very day, he was taken out into the garden and allowed to see the plants and flowers. And now he's actually transitioned over to adult services and is doing well. Although optimally, he requires a hematopoietic stem cell transplant.
Okay, like that was really, I don't know how to describe it, but none of us can really understand what he went through. Like we can't bring
Really
his childhood back, but
true.
definitely the treatment had served as a ray of hope for the whole family and for the kid himself, that he was able to
Exactly.
finally go out, meet other people other than the regular faces he was meeting all the days. So,
Yeah, and she says that now his behavior has actually changed. He
mm,
was very rebellious and always sullen and angry, but now he listens to them and he's a much happier child.
yeah, yeah. Like I think he had already told his feeling, like by the incident of that aquarium, he had always
True.
wanted to go out, meet people. So yeah, like
Yeah.
this was one story out of all the stories you have. This I think could have a direct relevance, like for any audience who are listening to this video. It shows the importance of knowing the genetics and doing research on that, how it would impact a human life at the end of the day. So thank you, ma'am. That was really an interesting story. Both stories were really, really insightful. So my next question was, like you had told even in the second story that people in the family advised to keep him isolated. That was for a different cause. They didn't want him to get infection from other people. But in case of some other genetic disorders, there can be like stigma, when there can be like a societal pressure which is attached with the family, with the patient or a kid. So in that cases, there needs to be more awareness. So what is your opinion about that whole topic of stigma?
Okay. Stigma among children
Mhm.
with congenital disorders is real,
Mm.
and the people who suffer from it maximally, apart from the
Mm.
children themselves, is of course the parents and mainly the mother. So, because the burden of care is really on the mother. And when it comes to X linked recessive disorders, there
Mm.
are several inborn errors of immunity which are transmitted X linked recessively,
Mm.
like, for example, X linked A gamma globulinemia, the X linked hyper IgM syndrome, and others. So, especially if there are multiple affected individuals on the
Mm.
maternal side,
Mm.
that's a huge problem.
True.
And the genetic counselors do a very delicate job to make sure that the mother is not abandoned
Mm.
and the family disruption does not occur.
Yeah.
So, as you rightly pointed out, enhancing awareness
Mm.
among the public is of paramount importance, along with enhancing awareness among medical professionals. So
Okay.
they need to give the right advice, and we also need uh, much more numbers of trained, qualified genetic counselors. So that is something that we really have a shortfall of. So we can, I think, use nursing professionals,
Hmm.
train them as to be good genetic counselors.
Hmm.
So probably in the future, we would have genetic nurses, so to speak, and also physician scientists who could delve more into genetics, genomics, and the like, and help in spreading awareness.
True, true. That was a very, very valid point, a unique point also, bringing out the importance of genetic counseling and how to use nurses getting trained in genetic counseling, ma'am. So, now that the cost of genomic technologies and genetic diagnosis, like there's a downfall and everything is getting advanced at a very rapid scale, what do you think would be the future need, or what do you think is the advancement that is needed to have a better national health policy or to provide a good quality of life for the patients?
Yeah. So I think now that we have genomic technologies that are becoming more and more affordable,
Yeah.
I think the state has to step in to make universal access to genomic technologies a reality.
Hmm.
So, apart from creating awareness, as I said, we need to improve access. We need to have much more numbers of well equipped laboratories. We need to have quality control, make sure that the reports, the sequencing reports that we have are really quality controlled, and we need to have professionals who are able to interpret these reports. So there is this huge need of more affordable technology, which is universally accessible
Hmm.
and accessible rapidly as well. So, for example, if we have a child
Hmm.
who is critically ill,
Hmm.
so there is absolutely no time for us. So the child crashes before you know it.
Hmm.
So if we could have a system by which genomic reports can be fast tracked for
Hmm.
children who are critically ill, that
Hmm.
is also something that we are really looking forward to. And of course, on the side of prevention,
Hmm.
so much more needs to be done to put in place newborn screening,
Hmm.
antenatal, prenatal diagnosis.
Hmm.
So these are all areas which are not yet well developed in our country, and there is this huge potential for it.
True, true, true. Very true, ma'am. And like you have always in all your previous responses also stressed on how we should move forward so that this technique can give a ray of hope for a lot of patients and the patient families, especially the mother. So this brings us to the end of this session, and now I would request you to give a kind of encouragement or a motivation message to all the students or researchers, young researchers and students who are about to start their studies in genetics or who are currently working on genetics. What would you like to say them on this occasion?
Yeah, after all, you're celebrating the 200th birth anniversary of Gregor Mendel.
Yeah.
So I think they should really go in depth and see how, in the face of adversity and absolutely very little resources that he had at his disposal, he was not allowed to work with even insects.
Yeah.
So, whatever was available, he made maximum use of it. And the power of observation and the scientific method of documentation and his passion and persistence, all this definitely have to be absorbed by new researchers. And I would say that they are at the right place at the right time, because as you are aware, our country has a high burden of inbred populations.
True.
Consanguinity is high, and because of we have these isolated communities,
Hmm.
autosomal recessively inherited disorders are much more common than they are in several other parts of the world. And at a population level, the genomic architecture is just being unraveled.
Hmm.
And therefore, there's the huge lot of work to be done. And it's really going to be an exciting journey for them. There will be new diseases to be discovered, new variants responsible for old diseases that have already been described. And on the whole, yeah, it's a huge plus for them, and there's everything to look forward to. And of course, there is this huge need. So there are so many diseases and communities who are suffering due to these diseases, communities and patients, families. So there is really a huge need for them to put in a lot of effort in this direction. The future is indeed bright for a researcher like you.
Thanks a lot, ma'am. That was really encouraging. And thanks a lot for sharing your time and also giving your opinions and your thought process about the current progress of genetics, even in the side of research or in a medical setting. Thanks a lot for joining us today, ma'am. And thanks a lot for your time.
Thank you so much, Mercy.
Okay.